So what is the right age for a facelift? This question comes up all the time. And I think the thinking about this has changed over time. I think in the past, we used to wait until we had all the signs of aging. Our brows were down to here, lots of eyelid hooding, neck and face drooping down. And then we went and did everything in one big shebang. And that is one way to do it. And some people still choose to do it that way. I think what's much more common these days is that people are opting for smaller procedures over time. And so it's not uncommon for me to do a facelift in a 40-year-old. And it's not because they have this huge neck and jowls and all this kind of stuff. It's because they're starting to see those changes. And we've now gotten to the point where I know what I can achieve surgically. And in somebody who is starting to see those signs of aging with jowls and things like that and changes in the neck, I know I can do a surgery and make them look great, to where instead of going from, whatever age grandma to like, boom, knocking off 20 years, you kind of just stay ageless. And this is what the celebrities do. This is what actors and actresses do to sort of maintain that youthfulness over time. And they're having little procedures here and there. So you just don't really see it. It just looks like, yeah, they look good, but you can't put your finger on it. That's exactly what we're going for. We want you to look like you're just genetically gifted and you just never aged that way. Some people do have that gift where they just never really age. A lot of people don't. And so there are some things you can do to help yourself stay looking young, in terms of staying out of the sun, in terms of not doing drugs or alcohol excessively. Sometimes it is our genetics, where unfortunately Caucasians just tend to age more than African Americans or than Asian people, and that primarily has to do with the quality of the skin. You see a lot more skin laxity in Caucasians. So if that's the case, then when should you do your facelift? Well, the answer to that is whenever you feel like you're ready for it. My job is not to tell you, oh, you're ready for a facelift. My job is to tell you if that's something that you're wanting to do, if that's a good idea. And I tend to see that around your 40s. By the time you hit your 40s, you're starting to see some changes where a facelift is helpful in terms of jowling, in terms of heaviness in the neck, in terms of laxity down here, where things have come down. There are certain predictable changes that happen to us over and over and over again in terms of upper eyelid hooding, in terms of descent of the brows, in terms of a lengthening of the upper lip, in terms of jowling, skin laxity, all this stuff. That's primarily what I do when I'm doing facelifts. We're doing really any number of procedures for each patient, and it's tailored to each patient. Sometimes I'm transferring fat, where we take fat from another part of the body and use it to fill areas that might be looking a little gaunt. And so knowing that, it's different for each patient. Some patients never have had surgery and they make it to age 65 and they decide that that's the right age for them. Some patients in their 40s decide that they don't like those signs of aging, and so we address that. I don't really do facelifts in 30-year-olds or younger because the benefit that you're going to get is really not worth the surgery. You're going to see a very minimal change. And so if I'm not really seeing jowls and skin laxity, I'm not going to do it. And I will tell you that. And maybe we do some Botox, maybe we do some lasers, things like that. But a facelift is really for a 40-year-old and up in general. Are there people in their late 30s who sometimes do have jowling and all this stuff? Yes, that can happen, but it's pretty unusual. And for most people, it's going to be in your 40s and up. The high end of the spectrum, that really just depends on how healthy you are and can you undergo a surgical procedure with anesthesia. Now, I don't use general anesthesia. I do everything under IV sedation. However, for an 80-year-old with a heart condition, probably not a good idea to have a facelift. If you're totally healthy and you're working out and you feel fine and really it's just a number, you're actually pretty healthy, okay, not on any medications, your lungs are good, your heart is good, your kidneys are good, great, then we can talk about it. So it really comes down to the individual, but in general, it's going to be from your mid-40s and up. That's the right age to have a facelift. What is it for you? It's going to be when you feel like the changes that you're seeing merit going through the cost, going through the recovery, going through all of those things that you're going to have to do. When you see a great before and after, it's easy to think like, boom, you just flip a switch and you're done. That's not how it works. There's a real recovery involved with it. So you do have to be prepared to go through a surgical procedure. And so that's why we're here, and we're pretty darn good at getting people through that experience. So in general, 2 weeks for recovery of downtime. After that time, you're still puffy. About a month, you're going to be looking pretty good. By 3 to 4 months, that's when you're really looking awesome. And sometimes it can take you a little bit longer than that as far as the incisions and all that kind of stuff for you to be undetectable without any makeup on. But for the most part, most people, by 3 to 4 months, you are undetectable and looking awesome. What questions do you have about aging? Hit me up in the comments. I would love to answer those questions for you. I'm Dr. Peter Vila. You're beautiful, and I will see you on the next video.